Chronic disease is a medical term used to describe health conditions that last for a long time, usually from a few months to a lifetime, and require regular treatment and monitoring. These diseases not only affect the quality of life, but also increase the medical burden on individuals, families, and society. Among the common chronic diseases, diabetes and hypertension are the two conditions with the highest incidence, especially in the elderly. Diabetes mellitus, is a disorder of blood sugar metabolism when the body does not produce enough insulin or does not use insulin effectively. If not well controlled, diabetes can cause many serious complications, such as damage to the kidneys, blood vessels, nerves, and vision. Hypertension, also known as high blood pressure, is when the blood pressure in the arteries is higher than normal for a long time. This is a silent killer because it often has no obvious symptoms but causes long-term damage to the heart, brain, and kidneys. Both of these diseases have a common feature. They cannot be completely cured, but can be effectively controlled through medical treatment combined with lifestyle changes. Understanding the disease, being aware of the role of nutrition, exercise, and natural support solutions will help patients be more proactive in taking care of their health. 2. Diabetes and high blood pressure, causes and consequences. 1. Diabetes, common causes. Diabetes, or diabetes mellitus, is a chronic blood sugar metabolism disorder caused by the body not producing enough insulin or not using insulin effectively. There are two main types. Type 1 diabetes accounts for about 5 to 10% of all cases, usually appearing in children or young adults due to the immune system attacking the pancreas, where insulin is produced. Type 2 diabetes accounts for up to 90 to 95% of cases, usually appearing in older people and closely related to lifestyle, diet, and being overweight. The main causes include genetics. People with parents or siblings with diabetes are at higher risk. Unhealthy diet, eating a lot of sugar, refined starches, processed foods. Lack of exercise. Lack of physical activity reduces the effectiveness of insulin. Being overweight or obese, especially belly fat, causes insulin resistance. 2. Hypertension, the silent disease. Hypertension is a condition in which blood pressure in the arteries increases over a long period of time. Blood pressure is considered high when it exceeds 140/90 mm. Possible causes include age. The older you are, the higher your risk of high blood pressure. Family history. Genetic factors play an important role. Lifestyle habits. Eating salty foods, smoking, drinking alcohol, prolonged stress. Lack of exercise, obesity, increases pressure on blood vessel walls. Hypertension often has no obvious symptoms in the early stages, causing the patient to not detect it until complications occur. 3. Serious consequences if not controlled. A. Complications of diabetes. Cardiovascular disease. People with diabetes are 2 to 4 times more likely to have heart attacks and strokes than normal people. Kidney failure. Diabetes is the leading cause of chronic kidney failure. Nerve damage causes numbness in hands and feet. Digestive disorders. Retinal disease can lead to blindness. B. Complications of high blood pressure. Cerebrovascular accident, stroke. The leading risk due to high blood pressure damaging brain vessels. Heart failure. The heart has to work too hard to pump blood. Kidney failure. Long-term high blood pressure damages small blood vessels in the kidneys. Retinal damage reduces vision or leads to blindness. The relationship between diabetes and blood pressure. Diabetes and high blood pressure often go together, especially in the elderly. Up to 70% of people with type 2 diabetes also have high blood pressure. These two conditions, when combined, increase the risk of cardiovascular complications, stroke, and death. Therefore, controlling both diseases at the same time is essential in long-term health management. 3. The role of lifestyle in chronic disease management. Chronic diseases such as diabetes and hypertension cannot be completely cured, however, they can be effectively controlled through maintaining a healthy lifestyle. In many medical studies and treatment practices, lifestyle changes are considered an important foundation, playing a role no less than medication. This is especially meaningful for the elderly, who are more vulnerable to serious complications of the disease. 1. Healthy lifestyle, the foundation of treatment. Lifestyle is not only the way of eating or living, but also the whole behavior that affects physical and mental health. With chronic diseases, some lifestyle factors play a decisive role, including diet, exercise habits, stress management, sleep quality, other healthy living habits, quitting smoking, reducing alcohol, regular health checkups. 2. Reasonable diet. The key to controlling blood sugar and blood pressure. A reasonable diet can help stabilize blood sugar for people with diabetes, reduce pressure on blood vessels, and reduce cholesterol for people with high blood pressure. Basic principles in eating. Reduce fast starch. Limit white rice, white bread, sugar, soft drinks. Increase fiber. Green vegetables, tubers, whole grains help slow down sugar absorption. Limit salt. Maximum 5 grams salt per day according to WASHO recommendations. Supplement good fats, such as omega-3 from salmon, walnuts, olive oil. Drink enough water. Helps purify the body and support kidney function. Eating on time, dividing meals into small portions, and avoiding skipping meals also helps stabilize blood sugar and blood pressure. 3. Exercise regularly. Increase metabolic efficiency. Exercise helps the body improve insulin sensitivity, reduce insulin resistance in diabetics, increase blood circulation, reduce cardiovascular pressure, control weight effectively. Suitable forms of exercise for the elderly. Walk briskly for 30 minutes every day. Practice Qigong, Tai Chi, gentle yoga. Cycle slowly, swim lightly. It is important to maintain a regular routine, at least 5 days a week. Even simple activities such as gardening and cleaning bring positive benefits. 4. Stress management. Control adverse hormones. Prolonged stress stimulates the body to secrete the hormone cortisol, a factor that increases blood sugar and blood pressure. Learning to relax and control emotions is essential. Some effective stress management methods: meditate or practice deep breathing every morning and evening. Listen to soft music, read books, talk to relatives, participate in community activities. Avoid negative news. Create a relaxing living space. 5. Sleep and regular activities. Lack of sleep or poor sleep affects the ability to regulate blood sugar and blood pressure. Elderly people need to get enough sleep 6 to 8 hours a day. Avoid using the phone before going to bed. Keep the bedroom quiet, dark, and cool. Go to bed on time. Limit staying up late. In addition, quitting smoking, limiting alcohol, and going for regular checkups helps detect complications early and monitor health indicators regularly. 6. Positive lifestyle, long-term impact. A healthy lifestyle not only supports treatment, but also significantly improves quality of life. Patients who control their lifestyle well often have longer life expectancy, more positive psychology, significantly reduced medical and hospitalization costs. 4. Natural treatment support methods. In recent years, in addition to modern medicine, many patients, especially the elderly, have sought natural treatment support methods to improve their overall health and enhance their quality of life. These methods do not replace medication, but can be very supportive if applied properly, under the supervision of a doctor. Here are some popular and scientifically based natural support methods in managing diabetes and high blood pressure. 1. Yoga and meditation. A. Yoga, combining movement and breathing. Yoga is an ancient practice originating from India, helping to improve both physical and mental health. For people with chronic diseases, for people with diabetes, some yoga movements help stimulate the pancreas, improve insulin production. For people with high blood pressure, yoga helps relax the nerves, stabilize the heart rate, and reduce blood pressure. Gentle postures such as Tadasana, standing up straight, Vrikshasana, tree, Shavasana, relaxation, are suitable for the elderly. B. Meditation, controlling stress, balancing hormones. Meditation helps regulate the mind, reduce cortisol, the stress hormone, indirectly stabilizing blood sugar and blood pressure. Just 10 to 15 minutes of meditation every morning or evening can bring long-term positive effects. 2. Natural herbs to support health stabilization. Many herbs have been studied to help control blood sugar and blood pressure if used in the right dosage. A. For people with diabetes, bitter melon helps lower blood sugar thanks to the active ingredient carotene. Young mango leaves help stabilize blood sugar, reduce cholesterol. Gynostema pentaphyllum improves insulin sensitivity, supports metabolism. B. For people with high blood pressure, garlic helps dilate blood vessels, lowers blood pressure slightly thanks to the active ingredient allicin. Guava leaves has the ability to support sodium excretion, stabilize blood pressure. Hibiscus, red artichoke, has antioxidant properties, mild diuretic. Note: the use of herbs should be consulted with a doctor. Avoid using them in combination with drugs because it can cause unwanted interactions. 3. Massage therapy, acupressure. Massage and acupressure are physical therapy methods that help increase blood circulation, reduce body aches and pains, supports nerve relaxation, reduces stress. For people with high blood pressure, gently massaging the neck, shoulders, and soles of the feet can help temporarily reduce blood pressure. For people with diabetes, regular massage helps improve circulation in the lower limbs, where complications due to blood vessel damage are common. 4. Acupuncture. Acupuncture, a traditional therapy in Oriental medicine, can help relieve pain, relax muscles, and improve blood circulation. Some studies show that acupuncture can help improve insulin sensitivity and help stabilize blood pressure to a certain extent. However, acupuncture needs to be performed by a specialist and should not be applied arbitrarily. 5. Music and mental therapy. Listening to soft music, meditation music, or classical symphonies has the following effects. Calms the nervous system, reduces heart rate and blood pressure, improves mood, reduces anxiety, a risk factor in diabetes and high blood pressure. Participating in spiritual activities such as meditation, reading Buddhist books, and joining a healthcare group not only helps stabilize emotions, but also creates a supportive community, which is very useful for the elderly living alone. 6. Aromatherapy. Using natural essential oils from lavender, peppermint, and orange can help reduce stress, improve sleep, increase feelings of relaxation and happiness. Patients can use an essential oil diffuser or drop a few drops on a handkerchief to relax every night. 7. Warning: when should you not use natural methods? Despite their many benefits, natural support methods are not a substitute for medical treatment. Some cases should not be applied on their own. People with serious complications, stroke, kidney failure. People who are taking many different medications. People with a history of allergies or immune disorders. Patients should consult their doctor before applying any therapy, especially if they are being treated with Western medicine. 5. Proper nutrition for people with chronic diseases. Nutrition plays a core role in controlling and supporting the treatment of chronic diseases, especially diabetes and high blood pressure. A proper diet not only helps stabilize blood sugar and blood pressure, but also helps prevent dangerous complications, improve resistance and quality of life of patients, especially the elderly. 1. General principles in building a diet. When building a menu for people with chronic diseases, it is necessary to follow some basic principles. Eat regularly. Do not skip meals. Do not eat too much at one time. Divide meals into small portions. 4 to 5 meals a day helps stabilize blood sugar more than eating 2 to 3 large meals. Control energy. Appropriate for weight, level of activity, and disease status. Balanced nutrition. Ensure adequate carbohydrates, complex carbohydrates, protein, good fats, vitamins, and minerals. Reduce sugar, salt, and saturated fat. This is a key factor in controlling both diabetes and high blood pressure. 2. Foods to prioritize. A. Foods rich in fiber. Green vegetables, kale, spinach, amaranth, broccoli. Low-sugar fruits, apples, grapefruit, guava, cantaloupe. Whole grains, oats, brown rice, black bread. Fiber helps slow down tofu, soybeans, chia seeds, flax seeds. Sea fish, salmon, mackerel, herring, rich in omega-3. Chicken breast, lean pork, eggs. Protein helps maintain muscle, especially important for the elderly to avoid muscle atrophy. C. Unsaturated fats. Olive oil, sesame oil, soybean oil. Walnuts, almonds, sunflower seeds. Helps protect the heart, supports anti-inflammatory. 3. Foods to limit or avoid. A. Foods high in sugar and fast starch. Cakes, candy, carbonated soft drinks. White rice, white bread, vermicelli, pho. These foods increase blood sugar quickly after eating. B. Salt and foods high in sodium. Pickles, salted eggplant, fish sauce, soy sauce, canned food. Braised dishes, stewed with strong spices. Limiting to less than 5 grams of salt or day helps control blood pressure more effectively. C. Bad fats. Animal fat, organs, chicken skin, duck skin. Fried foods, fast food, margarine. Causes increased blood fat, increased risk of cardiovascular disease. 4. Notes on food preparation. Limit frying and stir-frying with a lot of oil. Prioritize steaming, boiling, and lightly grilling. Do not season too salty or too sweet. Use natural alternative spices, such as onions, garlic, and ginger to enhance flavor. 5. Suggested daily menu for people with diabetes and high blood pressure. Morning. 1 bowl of oatmeal with chia seeds. 1 small apple. 1 cup of herbal tea, unsweetened. Morning snack. 1 handful of almonds, 10 to 15 seeds. Lunch. 1 small bowl of brown rice. Steamed salmon, boiled vegetables, broccoli, carrots. Green squash soup with shrimp. Afternoon snack. 1 glass of unsweetened soy milk or 1 guava. Evening. Green bean porridge, boiled vegetables. Dessert with cantaloupe or grapefruit. 6. Functional foods and supplements, should or shouldn't. Some patients choose to supplement vitamins and minerals such as vitamin B complex, C, D, magnesium, zinc, chromium, support sugar metabolism. Omega-3, support the cardiovascular system. However, use must be prescribed by a doctor, avoid abuse, or use by word of mouth. If you agree, I will continue with Part 6, Combining Medical Treatment and Natural Methods. Expected 800 words. Do you want me to continue writing? Download as Audio 6, Combining Medical Treatment and Natural Methods. In the treatment of chronic diseases, such as diabetes and hypertension, the most effective method is not to choose between modern medicine or natural therapy, but to combine both scientifically and appropriately. This approach helps to optimize treatment results, limit side effects, and improve the quality of life for patients, especially the elderly who have many accompanying health problems. 1. The irreplaceable role of modern medicine. Modern medicine with drugs to control blood sugar, blood pressure, and other biochemical indicators has proven to be clearly effective in controlling the disease and preventing complications. For diabetes, oral medications such as metformin, sulfonylurea, or insulin injections help maintain blood sugar at safe levels. For hypertension, drug groups such as diuretics, ACE inhibitors, beta blockers help control stable blood pressure, reducing the risk of stroke. However, Western medicine can cause side effects if used in the wrong dose, not closely monitored, or not combined with a healthy lifestyle. 2. Natural methods. Positive complementary role. As presented in the previous section, natural therapies such as yoga, meditation, using herbs, reasonable diet, gentle exercise help support treatment by reducing insulin resistance, improving blood vessel function, reducing oxidative stress, regulating hormones and mood, important factors in controlling chronic diseases. However, these methods are only supportive, cannot replace treatment drugs or intensive medical intervention when the disease progresses severely. 3. How to combine them scientifically and effectively. A. Do not stop taking the medicine without instructions. Many patients, when they see that their blood sugar or blood pressure is stable thanks to diet and exercise, often reduce or stop taking their medication on their own. This can cause a rebound effect that makes the condition more dangerous. Changing the dosage or stopping medication requires the guidance of a specialist, usually based on the results of regular tests and clinical monitoring. B. Tell your doctor if you are taking herbs or supplements. Some herbs or supplements can interact with the medications you are taking, reducing their effectiveness or causing side effects. For example, garlic can thin the blood when taken with anticoagulants. Ginseng can affect insulin and blood sugar levels. Therefore, patients need to fully inform their doctor about all products they are using, whether natural or synthetic. C. Maintain regular health checkups. The combination of modern and natural treatments is only meaningful when the patient can monitor the results through specific indicators: fasting blood sugar, HbA1c, blood pressure, blood lipids, liver and kidney function, etc. The doctor will base on that to adjust the treatment regimen or advise on appropriate complementary approaches. 4. Proactive and persistent mindset. Success in treating chronic diseases does not come from a single solution or in a short time. Patients need to have proactive mindset, understand the disease, monitor basic indicators, ask questions during medical examination. Persistence, maintain a diet, exercise, and take full medication. Combined thinking, do not rely too much on drugs, nor blindly follow natural methods that have no scientific basis. This balance will bring long-term effectiveness, stabilize health, and minimize the risk of dangerous complications. 7. Conclusion and recommendations. Chronic diseases such as diabetes and hypertension are major challenges to public health, especially in the elderly. Although they cannot be completely cured, if properly managed, patients can still maintain a healthy, active, and independent life for many years. 1. Review. What patients need to care about. A. Understand the nature of the disease. Correctly identifying the medical condition is the first and most important step. Diabetes is not simply eating a lot of sweets, and high blood pressure is not just being dizzy often. Both are the result of many factors: genetics, lifestyle, age, and environmental factors. B. Do not be subjective with complications. When not controlled, both diabetes and hypertension can cause serious complications: myocardial infarction, stroke, kidney failure, blindness. These complications not only affect physical health, but also negatively impact the family's mental and economic health. C. Lifestyle is key. A healthy lifestyle, including diet, exercise, stress management, and sleep, is fundamental to disease control. Even in the early stages of diabetes or hypertension, making appropriate lifestyle adjustments can help avoid medication or delay the need for medication. 2. Recommendations for patients and caregivers. A. Follow your doctor's treatment. Always take medication on time, in the correct dose, and do not stop or change it without medical advice. Patients need regular checkups and tests to monitor disease progression. B. Apply natural support methods scientifically. Measures such as yoga, meditation, herbal medicine, massage, mental therapy, etc. are very useful if combined properly. However, they should not be a complete substitute for conventional medical treatment. C. Regularly monitor health indicators: fasting blood sugar and 2 hours after eating, morning and evening blood pressure, HbA1c index for diabetic patients, blood lipids, liver and kidney function, BMI index, etc. Regular monitoring will help promptly detect abnormal signs and adjust the treatment regimen when necessary. D. Strengthening the role of relatives and the community. For the elderly, the companionship of relatives in reminding them to take medication, eat properly, and exercise together can make a big difference. In addition, health clubs and patient support groups are also positive environments to maintain optimism and discipline. 3. New thinking in chronic disease management: proactive, comprehensive, and sustainable. Instead of worrying, avoiding, or leaving it to medicine, patients need to approach chronic disease treatment with a new mindset: proactive, learn, research, and ask questions to doctors; comprehensive, combine modern medicine with natural support methods and lifestyle adjustments; sustainable, persistently maintain good habits every day, avoid erratic changes. In short, chronic diseases are a part of life, especially as we age. But with the right knowledge, initiative, and support from family and the medical community, patients can completely live healthy, happy, and useful lives. It is never too late to change. Whether at age 50, 60, or if you find this content useful, don't forget to click like to support sharing more valuable content. Subscribe to the channel so you don't miss new videos about natural health. Share the video with friends and relatives, because a timely advice can save a life.